Hello and welcome to our channel Nuturemite, where we provide informative videos regarding health and lifestyle. Please like, share and subscribe the channel and click on the bell icon for important notification and videos.
How to identify and create the right routine for acne-prone skin. Caring for acne-prone skin is about more than just slathering on blemishing-bursting products. It can involve lifestyle changes too, the first of which is often a new and improved skincare routine. Watch on for some expert tips on everything from picking and popping to effective clinical treatments. It depends on the type of acne. The simplest way to split acne is into non-inflammatory and inflammatory types. Non-inflammatory acne refers to clogged pores that appear as blackheads or whiteheads. It's the mildest type and is easy to spot. Blackheads have a dark appearance and can appear somewhat flat against the skin. Whiteheads are small skin-colored bumps. Inflammatory. Anything with a red or more robust appearance is essentially classified as inflammatory acne. This can range from papules and pustules to the more severe nodules and cysts. Papules are small red bumps, while pustules are small bumps that contain pus. Papules often turn into pustules. Then there's the deeper, more painful acne. These inflamed bumps are typically larger than your usual pimple and feel as if they are underneath the skin. It also depends on your skin type. It's common to link oily skin to acne. After all, excess oil is a known contributor to breakouts. But dry skin types can still experience acne for a number of reasons, whether it's due to environmental factors or a poor skincare routine that irritates the skin and clogs pores. Knowing which skin type you have can help you care for your acne is the best way possible. Dr. Yoram Harth, board-certified dermatologist and medical director of MD Acne, says there's an easy way to work out your skin type. First, wash your face with a mild baby soap. Gently pat it dry. Don't apply any skincare products. A couple of hours later, examine your skin. If it's shiny, you have oily skin. If it appears flaky, rough or red, you have dry skin. Combination skin will appear dry on the cheeks and shiny on the forehead, nose and chin, T-zone. Normal skin, meanwhile, will have a healthy glow with no visible issues. Bear in mind that it's possible to be acne-prone without having dry or oily skin. The vast majority of people have had acne once in their lifetimes. General tips and tricks. Treating acne doesn't just involve trying product after product. It encompasses careful cleansing and some simple lifestyle changes. Oh, and try not to pick at it. Wash twice a day and after sweating. Washing your face when you wake up and before you go to bed is recommended. Doing it more than twice a day, unless you are particularly sweaty, can irritate the skin. Be gentle. Don't scrub or use harsh exfoliants. This is dermatologist Dr. Brooke Baer's top piece of advice. Acne is not a dirt problem, she says. So scrubbing harder and using hard exfoliants don't help and can only lead to more redness and irritation. No picking or popping. It's super tempting to pop that pimple, but doing so can lead to scarring. It can also transfer bacteria into another pores and make what was a small pimple turn into deep inflamed acne. But if you must, do it safely. There's a proper popping method, officially known as extraction. Apply a warm compress to open the pores and use clean Q-tips to gently push down on either side of the blackhead or whitehead. It's best not to attempt this with deeper acne types like pustules. Routinely wash anything that comes into contact with your skin. Bedding, makeup brushes, and even phone screens can all harbor debris that can clog your pores. To avoid clogging your pores, the American Academy of Dermatology advises changing sheets weekly and pillowcases 2 or 3 times a week. Ideally, you should clean makeup tools every day, but if that's not feasible, try washing them once a week instead. Phones can be wiped with a special cleanser once or twice a day. Opt for non-comedogenic products. Non-comedogenic is a label you have probably seen quite a lot on skincare products. Sometimes it goes by the name of oil-free, non-acnegenic, or simply won't clog pores. Every product used on acne-prone areas should have the labels oil-free, non-comedogenic. You'd think any products labeled with this would only help acne-prone skin, right? Unfortunately, not. It's best to check the full ingredients list before using. Avoid anything that contains potential irritants like alcohol or fragrance. Review your hair care routine. Hair care formulas from shampoos and conditioners to generic styling products can cause breakouts in areas like the forehead and neck. Try to avoid any products containing oils. If you suspect your hair routine is your acne culprit, switch it up to see if there's any improvement. Oil in the hair itself can also transfer onto the skin. Try to keep your hair off your face as much as possible, especially at night time. Stay hydrated. Keeping the skin hydrated may help combat the excess oil that leads to acne. However, there's limited research to back this up. Still, there's no harm in sticking to the 8x8 rule, that is, drinking 8-ounce glasses a day 8 times. Beware of diet and supplement claims. Online, you will find plenty of supplement selling brands claiming to banish acne. But unless you are seriously deficient in a particular nutrient, there's little evidence to prove they help the skin much. The same goes for dietary advice. For example, only a small amount of research has found a link between diet and acne. It's best not to cut out a specific nutrient or entire food group without specialist advice. Basic skincare routine. A skincare routine that's not right for your skin type or concerns can end up causing more problems. Here is every step you should consider taking when dealing with acne-prone skin. You can find many of these products at a local drugstore. Some are more specialized and found at other retailers, so they may be more expensive. Use these recommendations as general guidelines of what to look for. And remember, the more lightweight the product, the better for your pores. Ingredients to look for. First, salicylic acid. It works to unclog pores and reduce inflammation. It is ideal for blackheads and whiteheads, but can also help pustules disappear quicker. Second, benzoyl peroxide. It kills acne-causing bacteria and therefore works best on inflammatory acne. Third, retinoids. Retinoids exfoliate the skin surface, removing the dead skin cells that clog pores, among other things. They also help stop inflammation and are fundamental to all forms of an acne regimen. Morning. First, cleanser. Cleansing skin in the morning can be a good component of an acne regimen. Second, toner. Use a toner to get rid of excess oil that may contribute to breakouts. Third, moisturizer. Whether your complexion is dry or oily, a moisturizer will keep skin hydrated. Fourth, sunscreen. Some acne treatments can increase your skin's sensitivity to sunlight. Protect it with a broad spectrum SPF 30 sunscreen. Fifth, makeup. While this isn't an essential step, makeup can quickly cover pimples and residual redness. Evening. First, makeup remover. If you have chosen to wear makeup, properly removing it will help keep pores unclogged. Second, cleanser. The day's events can leave a great deal of grime on the surface of the skin. Gently get rid of it before bed with a cleanser. Third, spot treatment. Applying a spot treatment after cleansing can allow the ingredients to work their way deep into the skin. As well as treating existing pimples, these products can target scarring and stop new breakouts. As needed, exfoliant. Exfoliate once or twice a week to remove dead skin cells that can block pores and lead to breakouts. Face mask. A well-formulated face mask can help combat oiliness and impurities, hydrate dry skin and reduce redness. Use up to 3 times a week for optimal results. When to see a dermatologist about your acne. Mild acne can usually be treated with the help of over-the-counter products. If it doesn't improve, you may consider making an appointment with a board-certified dermatologist. This is also the case for acne that's classed as moderate or severe, such as cystic acne or acne that's scarring your skin. These types require prescription medication. At your first appointment, you will be asked to detail your medical history and current skincare regimen. Your dermatologist will then examine your skin to determine whether you have acne and if you do, which type and grade it is. You will likely leave with a prescription for medication, either topical, oral, or both, and some lifestyle recommendations. You may also be asked to consider certain procedures to help soothe the skin and minimize scarring. Be prepared to go back for regular follow-ups, as a dermatologist will want to see how your skin is progressing and update your treatment plan accordingly. Clinical treatment options. Dermatologists use a number of treatments to help combat acne. These are split into prescription strength medications and in-office procedures. Medication. These include prescription topical antibiotics, a short course of oral antibiotics, and topical retinoids. Both retinoids, such as tretinoin and antibiotics, include benzoyl peroxide, and tetracyclines are ideal for cysts and nodules. Acne that's related to hormones may require a prescription for birth control pills, combination pills, or oral spirulolactone prescribed off-label. However, even if hormones aren't suspected to be a big culprit for your acne, these medications are often used successfully. Therefore, if you have acne, it's worth asking your doctor if these would be good for you. Procedures. Carried out in a dermatologist's office, these can be useful for several forms of acne. Lasers and chemical peels are a great help in decreasing redness and smoothing the skin out. Lasers and light therapies also have the ability to kill P. acnes, bacteria responsible for some types of acne, making them ideal for deeper forms of acne. Strong chemical peels, meanwhile, are designed to treat blackheads and papules. Big, painful cysts that don't improve with medication can also be drained by your dermatologist to speed up the healing process and reduce the chance of scarring. Patience is key here. Use an acne treatment for at least 1 month before thinking about trying a new one. Expect to wait up to 3 months before seeing a big difference. Not seeing any improvement? Consider switching to a new product or visiting a dermatologist for personalized advice. Whichever route you decide to go down, follow the instructions to a T for the best possible outcome.
Thank you. Please like, share and subscribe to the channel. Click on the bell icon for important notifications and videos.